People in Massachusetts take pride in developing advances in healthcare and quality of life for people with disabilities. For the second year in a row, groups of innovators will compete for investments at the JFK Library at an event called the Arc Tank 2.0. To tell us about the event and the powers of positive disruption is the CEO of the sponsoring human service organization, Northeast Arc, Joanne Simons. Thank you very much for being with us, Joanne.
Thank you.
First of all, before we get into the organizations, talk about your own personal connection to what's going on here.
Well, my journey is quite personal. I got into this industry quite by accident. I sometimes say it was an accident at birth, but actually it was one of great fortune. My first child was born with Down syndrome and 4 heart defects, and I was a very young mother. I had just finished college and had gone straight on to graduate school and got a master's degree in social work, and I suddenly found myself confronted with a challenge, which I turned into an opportunity, which how was I going to save his life and in the process save my life, because it was not exactly as my mother would have said. It wasn't what I might have written in your baby book.
Of course, you also hope that people can have that experience in a different way, and I guess what you want to change here is not necessarily medicine or healthcare, but the sort of the human equation around these things.
That's right. What we're looking to change is change the way people with disabilities, especially those with intellectual disabilities and autism, are included and accepted in our communities, and how they make wonderful family members and great students and employees and contribute to the fabric of our life.
Well, one of the things you have in mind here, and I guess this is number one, important for helping people, live better, but also be more, self-supporting too. And I guess that's helping people get jobs. So you have an idea that somebody has in the Shark Tank for this, the Arc Tank, of course?
Yes, well, the Arc Tank that you mentioned began last year when we got $1 million donation by Boston businessman Stephen Rosenthal, who challenged us to do something different. We could have just kept the money in our organization, which is what organizations usually do when a benefactor like that comes forward. But our board is very progressive and shared the same vision that Steve had, which is how can we use this money to challenge? How can we use this money to positively disrupt the field of intellectual disabilities, much the way we've seen innovation disrupt most of the services that we use every day. I'm shopping differently. I'm using delivery systems. I'm traveling differently. And we thought that there were same kinds of ideas that have changed transportation and shopping and all sorts of other industries could be applied to this industry as well. So we came up with the idea of calling it the Arc Tank, and we piloted, or premiered it, I should say, last year in partnership with the John F. Kennedy Library Foundation. And that was really a purposeful partnership. Stephen Rothstein, the executive director there, also has an interest in disability. But more importantly, the Kennedy family has been long leaders in disability. Munis Shriver and certainly her children, Timothy and Anthony, have carried on that legacy. But it was President Kennedy who really signed the first legislation that gave opportunities for people with disabilities, and then he challenged us all for a moonshot. And so we're trying to discover the moonshot. He challenged us to put a man on the moon, and we're trying to do the same thing in intellectual disability.
Well, it's pretty common these days to see people with disabilities holding down jobs, even some jobs with a fair amount of skills. But at the same time, some of those same people might not be able to get to those jobs if they don't have good public transportation. So you got an idea in the mix to deal with that, right?
That's right. So I'm glad you mentioned it, because transportation, believe it or not, is probably the #1 barrier to full inclusion, whether or not it's to employment or to social systems or to friendships. It's how do you get there? How do you get to a bowling alley? How do you get to a job? How do you get to a place of worship? So one of the ideas is actually coming from an organization in Illinois, which is taking off on the existing ideas of the way we use platforms, Lyft and Uber, and seeing whether or not we can apply that to the employees who we currently work in our industry, we call direct support professionals, who generally have to have a second or a third job only in order to make ends meet. What if we were able to create a platform so they were actually the drivers in the transportation system that could support people with disabilities? Because one of the #1 issues that prevents families from trusting alternative transportation besides themselves is how do we ensure the safety of their loved ones while they're in transportation? So we think this is a great idea, which will provide another source of income for the professionals that we employ in our day programs, our employment supports, or helping families, and ensure families that they're being driven by safe, reliable, and vetted people.
Most people are advocates for their own health care. They struggle with that. But there are some special struggles for people with disabilities, and you have an idea for maybe someone who can help with that? At least there's a community-based idea for doing that?
Well, I think there were a couple ideas in this round of competition, and one last year actually that is pretty interesting. This year is, how are we going to protect people with disabilities in a case of a natural disaster? Floodings, hurricanes, blizzards. We all take precautions, but more and more people with disabilities are living independently in the community and have different kinds of challenges when these kind of events occur. So there's an idea I can't wait to hear them pitch. And the other idea is, what happens when a person with an intellectual disability presents themselves in a situation where law enforcement or first responders are necessary? And how do we make sure that the first responders have the sensitivity and training to understand and help to work with that individual and sometimes de-escalate a situation that could potentially go awry?
And sometimes I can picture that responder needing a lifeline, is someone they can talk to who can explain what they need to know.
That's right, and really help guide them through that situation. And last year there was an interesting proposal by UMass Medical Center, which actually did get funded and was awarded $80,000 to establish a gap year program for medical and dental students to work in our industry for a year. Because one of the biggest challenges, I would say it's probably the largest challenge, is the access to health care, is the lack of adequately trained doctors, nurses, and dental professionals who are comfortable working with this population. And the other big barrier is the reimbursement rates of Medicaid. Well, that's an issue probably bigger than the Arc Tank, but we think we can help the accessibility to healthcare professionals.
How do you explain the kind of support for this? You mentioned there is this benefactor who wanted to put this in the pot here. Why is that happening, you think?
I think that people are realizing that it's a civil rights issue, it's a human rights issue, and that people with disabilities have been too long put on the sidelines. And in this booming economy, we can't really permit anybody to be left behind, because we need all hands on deck.
Well, you have some interesting ideas that are in the running, and if people want some more information about what you do, you've got a website that they can go to?
We do. It's called www.ne-arc.org, but they can just Google the Arc Tank, and it's free and open to the public. We just want you to RSVP so we have enough food for you.
Thank you very much for being with us.
Thank you.
Joanne Simons from Northeast Arc. We'll have more news in just a moment.